Hi, I'm Dr. Rajani. Thanks for joining me today. I'm showing you some Botox injections today, and I'm also going to talk about the top 3 reasons why people are scared to get Botox. There's common myths, but there's the top 3 that everyone asks when they come in, and they're easily clarified. So let's go through it. And when you watch the injections, a lot of it will make sense. Botox is the most common minimally invasive aesthetic procedure done today, and it's really ruled the world of aesthetic clinics and medical spas around the country since I started. If you like these videos, click like, remember to subscribe. Now Botox, there's 4 different ones in North America, Botox, or at least in the United States. There's Botox, then there was Dysport, then Xeomin, and now Jeuveau. And I have videos on all of them, but they work similarly and have a similar mechanism of action. The number 1 reason why people are scared is because of pain. So people are scared of the needle, and they see multiple needle pokes, and it's true. Oftentimes for a frontalis, or the forehead muscle, my average would be 6 to 12 pokes because of the sprinkling method that I might use, meaning using it diffusely over the muscle as opposed to just a few areas that will droop the brow. So pain is minimal because the needle is very thin. If you think the thinnest insulin gauge you can get is what we use, 31 or 32 gauge, most common. You can use topical anesthetic. Most people don't in this day and age. They want to be in and out, but I'll tell you 2 things that work. One is ice and pre-icing, and there's certain devices you'll see me use that freeze the area. There's freezing sprays. And the second is a VAD, a vibratory anesthetic device. And this can be used and placed around the injection area. And actually it works better than topical, even for much of the lip filler that's done today. So that's number 1 is pain. Number 2, people think it's a toxin. Now, we are using a full face may use 100 units or a high dose area, meaning if people want to increase the duration, you might double the dose. So instead of 20 here, you might use 40 around the eyes instead of 24, 48. So under 100 units is the point for the upper face, almost always. 50 would be an average. At those doses, it doesn't cause botulism, okay, which a lot of people are fearful of. With therapeutic Botox, hundreds of units are used. So we know the data. The other thing is there's over 20,000 peer-reviewed articles. One of the most studied drugs on the planet Earth. Next is it's been used in aesthetic Botox treatments. Botox was the first one approved aesthetically. I started in 2002 or so, and it was approved just before that. And so, but a long time, 25 years or so, and therapeutically before that. We know a lot about the drug. Toxicity with aesthetic use is, we never say impossible in medicine, but there are many more things you've probably done today that are way riskier. So it almost never happens. I personally don't know of a case. So toxicity, it's metabolized by the body, it doesn't spread, it doesn't go systemically. You can study that if that's one of your concerns. But that's the second most common fear. The third, the dreaded brow droop or lid droop. They're 2 different things. Watch my video on that, not to go into detail in order to keep this a little bit more brief for you. But here's the point. You can 100% avoid the injections that cause the lid or the brow droop. So you can just not do those. The downside of not is mostly people want a smooth forehead, and it's the forehead injections, watch my video on the forehead drooping, that are going to cause that to happen. So a smooth forehead, however, is easily obtained by other treatments. The less Botox in the forehead, the better. So PDO threads, RF, fractionated RF, retinols, you can do that at home. They work great. Retinoic acids. Watch my video on the retinol tutorial. I'll put a little link up here and at the end of the video as well and below, because retinols are my number 1, along with growth factor serums that I talk about. And they can smooth the skin, and that way you don't have to get the droop, which comes from the forehead injection. So the drooping can be fully avoided, and it's really rare. The lid droop was when I started 2002-ish, about 4% in the studies, and now it is much less than 1%. Why? It's the depth of injection. And that's why injecting Botox, despite what many people think, isn't simple. It's the dilutions, the depths, the amount of boluses, and the version make a difference, meaning what type of Botox. It's a brand name, but people call them all Botox. They all have different characteristics. So unless you're doing it every day and every week, it's hard to know how. So those are 3 reasons. Here's some playlists up here that follow up on exactly these points. Stay tuned here. Keep your skin and body beautiful, healthy, and vibrant.